She is trying to train and brief the Yuva Bharat, the youth of India, the young boys and girls who are getting into various career path. The first question that I would like to ask you, Garima, is tell me briefly, very briefly, about your journey in law.
Uh, so my journey in law started. I think my fascination towards research is one of the reasons why I diverted myself. This law actually started when I started going practically to the field. Uh, I also believe that once I started going to the ground level,
Yeah.
I understood the nuances.
Hmm.
So whatever you learn within the books, it's very different what you see outside. So I would say that it started long back, and I've been very fortunate that last couple of 5 6 years I've been constantly working with national commissions in the field of women rights, child rights, compensation schemes, and hate crimes. Also, I've published around 6 books and almost 25 papers nationally as well as internationally. My areas of research have been majorly criminal justice administration, uh, victim centric policy analysis, and currently I'm working with the Maharashtra National Law University, Mumbai.
Really done well as far as law is concerned to understand the law and in context to the psychology of criminals, in context to giving legal help to innocent people. There is one, since I have been in the journalism field for so many years, I have come across so many stories in print, in TV, in internet, in radio, where we see that youth are depressed, and when they are depressed they take in drugs, they go for alcohol, and this is increasing rapidly. We see so much in Punjab, we see in so many other states. uh, how how do we stop it? I mean, what should be the remedy taken by, teachers role, parents role, media's role? What do you say about it briefly?
So youth in India, that's the category around 15 to
Yeah.
24 if I talk about. They face a significant pressure, so with terms of whether it is academics, career, uncertainty, a lot of family expectations. In fact, social media, I think, has a role there for the pressure part. And a lot of economical challenges are also there, which actually contribute to this depression and rejection. And this often also leads to a lot of substance usage to cope up uh, from this issue. So,
Hmm.
what I believe, rather than getting completely into the institutional help within home, I think the first step should be taken. Rehabilitation, I believe, starts from home. So, I believe that the parents today have to actually understand their child firstly, communicate, sir. That's, I think, which is missing even now. I believe, even I've seen it within my family. We don't communicate to our children. And
Hmm.
I think that becomes a major problem where a child or youth, in fact, this generation, definitely gets exposed to this outside usage. I mean, the substance abuse. And if the channel of communication is within your home, I think a lot of it can change. So, my first thing would be rehabilitation within the home. That actually helps a lot. Then, so physical activity. I think by and large, I've seen you if you get into regular exercises, sports, for instance, you have so many new sports coming up. Yoga, it actually have proven to release a lot of endorphins and build a very disciplined life. That's another, you know, a measure which can be taken. Skill building, sir. something again people generally avoid. Like you can take up a lot many hobbies. You can read, volunteer for small NGOs. So these are very small, achievable wins, to create a certain momentum. One needs to be very mindful, and of course therapy is there, meditation like being one of it, journaling, sir, I believe, because when even I was going through it, I used to write a lot. I think it helps a lot to negate the thoughts which linger around. This
Garima,
one,
Dr. Garima, what
yes,
you
sir.
are talking about is the case study, or you are talking about the patients, I mean, who are, victims of drugs and alcohol. But
So
how do you rectify before this? I mean, prevention is better than cure. Is there some
definitely, sir.
mechanism where we can stop our young talents from going into that dark space?
So, like I said, this communication in India is very limited. So, we don't address this issue of depression or any anxiety. Also, if
If
somebody
if
is
if
suffering,
communication is lacking, what do you think is the primary cause? Why there is no communication between uh, kids and parents, kids and
so
people?
it's not about kids only. I can talk about faculties also. I
Okay,
have been in that place.
what's
So
the
we
prime
judge a lot.
reason?
So I think the mentality and the thought process in India, it needs to be changed a lot. We don't consider anxiety, depression as something major till somebody
Okay.
actually commits suicide or gets into substance abuse. We
Hmm.
think that the person is looking for some kind of an attention, and that's why you ignore it. So, ignorance again, if you go and to or talk to parents also, they don't consider it as an issue also.
Right.
So this ignorance or denial, which in psychology is a kind of defense mechanism, I think I've seen by and large lot many parents, in fact faculties also, I've seen, with all due respect, they don't address it. So they think that it is not an issue. Unfortunately, as academicians, I think we need to be very open in our approaches, because ultimately,
No,
we are
because there is a
creating these
taboo. There is a taboo involved with this. Anybody who goes to a psychiatrist or a doctor who deals with the
psychologists.
mind, people think कि ये पागल हो गया है. That's the kind
Yes,
of
sir.
stigma.
So if you go and talk to people, I mean, if you suggest also that you can go to and visit a therapist and all,
Hmm.
uh, they frown. They think you, and I totally agree that you are mentally not stable, and they judge you. That's why I said so. A lot many people. That's why, firstly, they are not aware that they have some kind of issue,
So you
or
you
this,
mean to say,
or
Dr.
they
Garima, that counseling is really, really very, very important. So, but do we have so
absolutely.
many counselors where we can easily go? And most of the counselors who do counseling for married couples or for CEOs of companies, they charge a lot. Their fees are very high. So how do a common man whose salary is, say, somewhere around 25,000 or 30,000, if that boy is
So
newly married,
yes,
how will
so
he handle it?
like like I said, sir, you are absolutely correct when you talk about the commercialization part of it. I'm talking about the entire process starts from your
Hmm.
home. Firstly, the parents have to be so much exposed and so much, you know, acceptable that there is some issue my child is suffering from. I
Hmm.
need to address it rather than ignoring it. Because majority of the households, people are not aware only. Secondly, like I said, the second step is within the school. Schools have to be more, I mean, the teachers, the principals, they have to be so open minded that there is an issue which has to be addressed. So I think within the curriculum also, this particular aspect of psychology has to be taken into consideration. That is what I mean, I believe it might benefit the children. So if from the start only, from the schools only, if we try to, acknowledge, address, talk about these things, I think it's going to benefit lot many people, in fact, when they enter the college, I mean universities, it might benefit them a lot.